Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, we are honored to welcome the team from the NDSS, the National Down Syndrome Society. Welcome the team from the National Down Syndrome Society, Margot Rhondeau, Anna Fedowa, and Charlotte Woodward. Thank you, ladies, for joining us today.
Thanks so much for having us.
It's our pleasure. I want to start just by having each of you do a little introduction, a little about you for our viewers and listeners. Margot, we'll start with you.
Sure. My name is Margot Rhondeau. I am the Senior Director of Health and Wellness at the National Down Syndrome Society. I've been here for about 4.5, 5 years now. And I think what really makes this so close to my heart is that I have a daughter with Down syndrome. I've been in the health space for all of my career and really excited to be able to focus on Down syndrome now.
Awesome. Well, thank you for being with us. Anna?
Yes, hi everyone, and thank you so much for having me. My name is Anna Fedowa, and I'm the Senior Manager of Government Relations at NDSS, so I have the privilege of getting to lead our team in our policy and advocacy efforts, both at the federal and state level. I've been here about 5 years as well, and my kind of introduction or connection to the Down syndrome community is actually through friendships I had growing up as a small child with individuals with Down syndrome and other disabilities. And as we've gotten older and grown through our lives, I've gotten to see the real world impact of caregiving and home care and all of it that comes with aging with a disability. So really excited to be having this conversation today.
Well, thank you. Thanks for being here. Charlotte, how about you? Welcome.
Yes, hi. My name is Charlotte Woodward. I am the Programs Associate at the National Down Syndrome Society. I am involved in all of NDSS's programmatic areas, policy and advocacy, educational, health and wellness, employment, etc., etc. And I think that's it.
Okay.
You'll hear more later.
Okay, great. Looking forward to it. Well, Margot, I want to kind of start with you. Could you kind of explain for viewers and listeners what is Down syndrome and what should we really know about the people living with Down syndrome?
Sure. So Down syndrome is the most common chromosomal difference. It occurs when there's an extra or partial extra copy of the 21st chromosome. So people with Down syndrome, we all have chromosomes in our body that are the building blocks that tell us how we should be. And so individuals with Down syndrome have an extra one. That extra one can come out in a variety of different ways. So sometimes people with Down syndrome look a little different. Sometimes the way they think is a little different. The way they learn is a little different. But what's really important to know is they're just people like everyone else. They have preferences. They have things they don't like. They have, things that they do like, things they want to do, things they want to eat. Friendships are really important. So everything you think about when you think about just a human applies to somebody with Down syndrome. One really exciting thing for our community is that in the 1980s, the life expectancy for somebody with Down syndrome was about 25 years old.
Wow.
And due to deinstitutionalization, due to advances in medical care, the life expectancy is about 60 years old, which is incredible. I don't know of any other group that has had that really expansion in life expectancy in such a short period of time. It means, quite amazingly, that most people who are older adults with Down syndrome, when they were born, they were never supposed to live this long. And so they are getting to enjoy a period of life that they never expected. Their parents, their siblings, their families never expected. And in many ways, they are the trailblazers for us. It also means we're just learning a lot about what it means to age with Down syndrome, because we haven't had generations come before us to say, this is what we know, and this is the things that you should know. So a lot of us, we're learning as we're going, and we're really appreciative to those in our community that are helping us along the way.
Yeah.
One last thing I would just note about Down syndrome is that they have an extra 21st chromosome, but all their chromosomes came from their parents. And so at the end of the day, people with Down syndrome are more like their parents, more like their siblings than anybody else. So I mentioned earlier that I have a daughter with Down syndrome, and I have the pleasure of working with Charlotte, who has Down syndrome. But the similarities between the two of them are just as much as the similarity between me and my mother. I mean, my mother and Charlotte's mother. That yes, there is a common factor that they all have an additional chromosome, but that's pretty much it. Everybody is a unique person who is most like their family more than anybody else.
Yeah, that's a good point. Real quick before I go to Anna, you mentioned the life expectancy growth, right? The higher average, and they're less institutionalized and things like that, more awareness. What would you say is the most single important determining factor in that growth in the life expectancy? Because that is quite remarkable.
So deinstitutionalization, I think it is, there's two that really stand out. That being one, we know institutions are not good for people. The medical care, the nutrition, sort of everything that you think about living in an institution is not good for somebody. It's quite bad. The other thing is 50% of people with Down syndrome are born with congenital heart defects. And the majority of people who are born with one do need heart surgery. And babies' hearts are about that. They're teeny tiny little hearts. And we've just gotten better at operating on teeny tiny hearts. And so the advances in pediatric cardiology care have gotten a lot. Pediatric cardiac care has gotten a lot better, which just means that people are living longer and able to increase that life expectancy.
That's incredible. Do you guys expect that you'll see that life expectancy continue to rise over time as well?
We hope. I mean, right now, and I know we'll discuss about this in a little bit, but right now we're sort of hitting another barrier that is causing the life expectancy to be about 60, and we have high hopes that we can work together as a community to push that barrier.
That's wonderful. Thank you, Margot. Anna, let's go to you. I introduced you guys as a team from the NDSS, the National Down Syndrome Society, but for people who may not be familiar with the NDSS, how do you describe it and what is it?
Yeah, absolutely. So NDSS is a 501c3 nonprofit. We're based in Washington, D.C. now, but we were actually founded in New York City back in 1979 by a family, by a mom, Betsy Goodwin, who had a daughter, Carson, born with Down syndrome. And I think just building off of what Margot just said, right? 1979, 1980s, you look around and the life expectancy and the expectations for people with Down syndrome were so low. And Betsy said, I want more for my daughter. I want better for my daughter and her siblings and our family. And that led her to create NDSS and to advocate for her daughter and thousands of other people with Down syndrome for higher expectations, for better healthcare outcomes. Policy and advocacy has always been baked into the work we do here, understanding that sometimes systems level change, policy change is needed to give individuals with Down syndrome the opportunities, healthcare, and everything that they deserve. But at our core, we're an organization that was founded by families, that serves individuals with Down syndrome and walks alongside them through all stages of life, not just through our policy and advocacy work, but through developing resources, hosting community events. We operate a helpline where we get thousands of calls every year from families and individuals with Down syndrome looking to learn more or get referrals. So really at the core of our work is just creating a better world for people with Down syndrome and their families.
No, that's wonderful. And we're going to have all the contact information in the show notes, but for people watching or listening, and I'm going to put you on the spot, what's the phone number that families can call?
Oh, Margot, do you know it? It's on all of our business cards, on every email chain.
1-800-221-4602.
Okay.
Also info@ndss.org. If you have any health questions, health@ndss.org. We'll send you to my team, and Anna's team also has I think it's advocacy@ndss.org.
We're policy@ndss.org if you have. But
policy at
info@ndss.org is usually a good place to start, and then you'll get referred out to whichever team can help you best.
Perfect. Ask for a phone number, and we got an email. Thank you, guys. Charlotte, let's go to you. I want to talk to you because I feel like there's myths and stigmas associated with any sort of disability or anybody that looks different than us, and I want you to share, what do you want people to know about living with Down syndrome and some of the myths that are just myths and not true?
Well, First of all, I would like to mention that my doctors told my mom that I would never learn to read and write, and that one day I would work in a shuttle workshop for a sub minimum wage. And my mom did not understand how the doctors can make such predictions about my future, abilities, and the path I would follow in life. Thankfully, she did not take the doctor's words to heart. She was determined to do her very, very best to help me learn as much as I could, which resulted in me becoming a lifelong learner. Despite the doctor's predictions that I would most likely never learn to read or write, I did learn to read and write at a very young age, I might add. I even went on to George Mason University, where I graduated from with a Bachelor's of Arts degree in sociology, with a concentration in inequality and social change. And I graduated summa cum laude, too. In other words, I really wish those doctors who made such dire predictions about my future could see me now. And lastly, I want to mention that there was this one administrator in my high school, and I'm going to see the word that I don't like. She was in charge of the mental retardation program, but I'm thankful that that word has changed to intellectual and developmental disability. But anyway, that administrator wanted to put me in the school's special education program because she assumed that since I have Down syndrome, that's where everyone with Down syndrome goes. But like I had said about me going to George Mason University and graduating, I went to that this too.
So when the doctor said that to your mom, what time period was this, Charlotte?
I was just a baby. I was born in 1989.
Okay. So have you seen changes the way healthcare then looks at people born with Down syndrome and how they address it?
I think it depends.
Mm-hmm.
But like Margot and Anna said, we have seen a few changes in healthcare, but not at the level we expect it to be at. There is still systemic and structural biases, myths, misconceptions, stereotypes, low expectations, discrimination, and things like that are still in play that we are fighting every day to get rid of, and it's going to be a long journey, and it's not going to be easy.
Yeah, absolutely. Are there any other myths that just the general public might have that you want to help to clarify?
Well, I know that that they think people with Down syndrome can be contributing members to society. That Down syndrome is a rare disorder. That Down syndrome is hereditary and runs in families. That most children with Down syndrome are born to older parents. That parents will not find community support in bringing up their child with Down syndrome. And that all people with Down syndrome have a severe cognitive disability. That people with Down syndrome are always sick. that scientists know everything there is to know about Down syndrome, that segregated special education programs are the only option for students with Down syndrome, that people with Down syndrome cannot be active members of their community, that people with Down syndrome are always happy, that adults with Down syndrome are the same as children with Down syndrome, that adults with Down syndrome are unable to form close interpersonal relationships leading to marriage, that adults with Down syndrome are unemployable, and that it is okay to use the R word if you don't really mean it.
Mm. Yeah.
And that's not acceptable.
No, not at all. And you're helping to make those changes, right?
Correct.
You know, speaking of changes, and I don't know, forgive me if I'm not supposed to mention this, but didn't you not just have a bill passed in your name?
Mm-hmm.
You want to share about that?
Well, as it stands right now, there is now federal legislation before or I should say it passed out of committee on April 29th. Correct me if I'm wrong, Anna, but I think that's the date. Then sometime in June, it passed the full House of Representatives and was reintroduced into the Senate. So that's where it is now. And the name of the bill is the Charlotte Woodward Organ Transplant Discrimination Prevention Act. And it's all about organ transplants. I was also born with a significant heart condition, which is common in babies who are born with Down syndrome. Approximately 50% of babies with Down syndrome are also born with a heart condition. I've had 4 open heart surgeries, 3 as a baby, and 1 when I was 10 years old. As I grew, my heart struggled to support my body, and my doctors determined that there was nothing more that could be done surgically to help my heart. They told me that I was in need of a heart transplant. Fortunately, my transplant team considered me an excellent candidate for this life-saving procedure, and on January 30th, 2012, I received a healthy new heart, and I've been in excellent health ever since. And I'm so very, very grateful for the generosity of my heart donor and to the family, as well as for the willingness of my medical team to provide me with the opportunity to receive this life-saving gift.
That's wonderful. That's great, Charlotte.
And of course, as you know, too often people with disabilities are denied life-saving organ transplants because of institutional bias, prejudice, and discrimination in the medical field against people with intellectual and developmental disabilities and other disability conditions. According to the National Down Syndrome Society, people with disabilities, especially in intellectual disabilities, have been denied access to organs because of subjective judgment about the value of a life with a disability, assumptions about the quality of life, and misconceptions about their ability to comply with post-operative care.
No, that was incredible. You know, and one more quick question, and then I'm going to go back to Margot. Was there ever a question, or was it ever in doubt that you would be allowed to have the transplant because of all the things you just listed?
There's no question that I would receive a heart transplant.
Okay, that's great. Well, thank you so much, Charlotte.
But like I had said, and you'll hear more about this in the other question you have for me, but the barriers I have just mentioned, that plays a lot in in the barriers of people with disabilities in accessing organ transplant care.
It's incredible. You are very inspirational. You know, Margot, I mean, I don't know what to say. Charlotte's incredible. I know you ladies definitely agree, but I am just thoroughly just inspired by you, Charlotte. So thank you for being you and doing what you're doing. And I think a lot of people will say thank you one day for all the work you're doing. I want to kind of transition, Margot, to how we initially became connected, and that was kind of the connection and correlation between Down syndrome and Alzheimer's. But I thought it was very important for people to be aware and educated about what Down syndrome is because of all the myths and things associated with it. But what should we really know about Down syndrome and Alzheimer's disease and that correlation?
Yeah, I mean, just to sort of follow up with what you were first saying, Charlotte is really hard act to follow. She is an incredible person who has, busted all of the barriers that have been put in front of her, and has a college degree, has a great job, has wonderful coworkers, of course, but also, has relationships and friendships and meaning, right? Has a very, very meaningful life, and I think that. As she mentioned, still today, people are, when they get the diagnosis about their child, the meaningful life part is really put into question, and it shouldn't be, because Charlotte is a really great example, and our other coworkers with Down syndrome, and our friends and our colleagues, and everyone we know with Down syndrome. And there's some great actually research out there that says that people with Down syndrome are really happy with their lives, and I think that's really important. With Alzheimer's, I had mentioned earlier about the life expectancy, and we've sort of hit this new barrier. And unfortunately, this new barrier is Alzheimer's disease, which is awful. I mean, I think anybody that knows anything about Alzheimer's disease really appreciates it's a very, very terrible disease, and a very terrible thing for our person to go through, and for their family members to go through, and to watch somebody go through. The gene that is really closely associated with Alzheimer's, the APP gene, sits on the 21st chromosome. And that's the gene that tells your body to create the proteins that build up in your brain and create the plaques and tangles in your brain that are, really high indicator of having Alzheimer's disease. And that gene sits on the 21st chromosome. And because people with Down syndrome have 3 of the 21st chromosome, they overproduce this protein. And because of that, the incidence rate of Alzheimer's is quite high. Charlotte and I have talked about this, so this is not a statistic I would normally just throw around in front of my friends with Down syndrome, but it is about a 90% lifetime risk. Not everybody with Down syndrome, interestingly enough, has that gene. And some of it is because I mentioned previously, Down syndrome can be caused by a partial triplication of the 21st chromosome. So not everybody with Down syndrome is going to get Alzheimer's disease. And that's really important. Both facts are really important to keep in mind, is that it is really highly probable, but it's not 100%. And so it is just one thing that our community is really trying to fight for right now, and also really go to the Alzheimer's, everybody that's working for Alzheimer's, and saying, did you know that our population, our community, has such a high incidence rate, and we should be included in everything you're doing? Because, and I always say this to Anna, right? Like, inclusion doesn't happen if it's not intentional. So if you develop a program for caregivers for people with Alzheimer's disease, and we'll go into this in a minute, our caregivers are different. And so it doesn't work for our caregivers unless you think about how our caregivers are different. Diagnosing Alzheimer's disease in somebody with Down syndrome is very, very different than the general population. The general population, there's at one point, I think you have to draw a clock. What if you never know how to draw a clock, right? And that's not a good indication if you have Alzheimer's disease, to ask somebody to do something that they don't know how to do. And have never known how to do. And so luckily there are some tools for individuals with intellectual and developmental disabilities that are much more of like, let's take a benchmark here and let's do evaluations time over time. And it's the same evaluation, so that you can track functioning to see, is Alzheimer's something that we should be aware of. One thing that's also sort of happening on the flip side is, because people know about the connection between Down syndrome and Alzheimer's disease, anytime anything happens, some doctors automatically say, oh, it's Alzheimer's disease. So we'll have people who are 20 being diagnosed with Alzheimer's disease. And I am not a doctor, but I would say that that's probably not what is happening. Which then makes you live this, it's not great, right? It's not great to be told that anybody in your family has Alzheimer's disease, but especially not your 20-year-old child. So we have misdiagnosis, we have underdiagnosis, we have overdiagnosis, we have sort of all of the in between of just a lack of appreciation of Alzheimer's disease and Down syndrome. How does it present? When does it present? What does it mean? And an appreciation for our policymakers and our drug makers and our clinical trial runners and all the things that people with Down syndrome really should be included.
Right.
Yeah, sorry, it's a little bit of a soapbox, but I will.
Well, quick question to that though, because dementia as a whole is sometimes often misdiagnosed or missed entirely, and because not all doctors are aware of it. If you go to your family doctor, they may have a very small understanding of it, so it might go undiagnosed or misdiagnosed. But when you add that complexity of somebody with Down syndrome going in, and like you mentioned as your example, the 20-year-old child being diagnosed with it, and it's probably most likely definitely not Alzheimer's, what do you recommend to families when they're going to a doctor to make sure they're going to the right type of doctor and a doctor that is going to give them a good diagnosis rather than cause more issues?
Yeah, I think that's a great question, right? And that happens across all ages is people will say, how do I find a doctor that knows about Down syndrome? And that's great. If you can find a unicorn, that's amazing. But also what you really need is a doctor that wants to learn more about Down syndrome. They don't need to be an expert. There's a lot of information out there. We've sent you resources. We have resources on our website. There are other groups that have resources that can help doctors know what they need to know. So you really need to find someone who is caring, who's compassionate and open to learning more. But that's what I would say, right? Is try to find a doctor who's willing to learn from you, and then who's willing to plug in. There's something called DISMIG, which is the Down Syndrome Medical Interest Group, is a great group of doctors to talk to. They have a listserv, and you can ask questions. And they have an echo model, which is like a webinar model in which people can interact and learn from each other. And so there are a lot of great resources out there.
Okay, wonderful. You mentioned something that's kind of near and dear to our heart here, and that's caregivers. And you kind of alluded to it, but maybe you want to do a deeper dive. How is caring for somebody with Down syndrome and Alzheimer's disease different than caring for someone with just Alzheimer's disease?
Yeah. So when you think about somebody with just Alzheimer's disease, and I shouldn't say just Alzheimer's disease again, because it is terrible. Typically their caregivers tend to be their spouses, their children, their, maybe grandchildren, but it tends to be the generations under them, maybe their generation or the generation under them. For people with Down syndrome, their caregivers, quite honestly, it usually starts with parents. And they're aging parents, right? I mean, imagine being 80 years old and having a 50-year-old child with Down syndrome developing Alzheimer's disease that you're trying to care for as an 80-year-old. It's not ideal. There's a lot of difficulties and a lot of sort of things going into that statement. And sometimes siblings, right? So again, the siblings are also 40 or 50 years old, taking care of their sibling with Down syndrome, who's 40, 50 years old, going through these changes. And so it's just a different group of people. So parents, elderly parents, caring for aging children, siblings caring for aging children. And then sometimes it will be hired professionals or through memory care centers or long-term care centers. But quite honestly, it can be very, very difficult to find a place like that will take somebody. Oftentimes they use the age 60 as a minimum, and so they don't take people under the age of 60. Down syndrome, individuals with Down syndrome the average age of diagnosis of Alzheimer's disease is actually 50s. And so that's when we need help. And then there's places saying, we're not going to help you until you turn 60. And at that point, it's too late. You're not being helpful. We need help now. Yeah. And there are some wonderful places that will, but I think it's a lack of finances. It's a lack of education. It's a lack of people. And it's difficult.
Right. Yeah. And I was going to say finances then become your next obstacle at that age. Yeah.
Yes. Right. Like who's going to, if you find a long-term care center, those places tend to be quite expensive. And as a parent, speaking for myself as a parent, am I saving enough to pay for that for my child? That will come and however many, or hopefully won't come, because the world is going to find a solution. But it is a very difficult scenario. And so when we were talking about caregiving earlier, again, as an 80-year-old, you need help, right? You need to have people who can come into your house and who can help you. And I think also if you look at it from the scenario, Charlotte was mentioning a lot of the things that she's done in her life. And I'm going to make some giant assumptions that her mom really supported her in the beginning, right? To help Charlotte with PT, OT, speech, right? And fighting the education system and fighting the healthcare system. And imagine being a parent who is fighting for all of these things and has, and then your child takes off and they have reached the top of the mountain and they are doing everything that you could ever want your child to do, and then be diagnosed with Alzheimer's disease. Yeah. In some way, it feels a little bit like you're rolling back down the mountain that you've spent your whole life climbing, and it's heartbreaking, and you need help, because as an 80-year-old, and I'm just throwing that number out there as an example, but like an 80-year-old, it's hard. You can't fight the same fight that you could as a 30-year-old.
Oh, absolutely. So how are you in the NDSS helping to support these families?
1 second, I have to call. So at NDSS, we're helping the families in a variety of ways. And I'll let Anna speak about what the policy and advocacy team is doing, because I don't want to steal her thunder now. But our team and the health and wellness team, we work a lot to help create resources to help families, parents, caregivers understand when to start looking out for the signs of Alzheimer's disease. How do you know when it's Alzheimer's disease? What is it going to look like over the next couple of years? And what suggestions can we give you to help with those years of life, to help support you and support your loved one? Also looking at the caregiver, right? It's really important. It's easy to focus on the person with the diagnosis, and it's easy, as I'm sure you can appreciate, to lose sight of what the caregiver needs. And it is very difficult. It's very, very difficult. And caregivers need to take care of themselves, and they need support, and they need a lot of that as well. And so really working with our caregivers of helping them appreciate that you can't give 120% of yourself all day, every day. At some point, you need to take a break, you need to refresh, and then start anew. So we've created a bunch of resources, and we've sent you the links to the resources and the covers and the guides of all the resources, but helping people understand, what does it mean to age with Down syndrome? I mentioned earlier that it's new for our population. I always sort of talk about how, as the mother of a young daughter, I have the benefit of generations of moms who have come before me, and they tell me what to do, how to do it, and when to do it, and why to do it. And not that simple, right? But I have a lot of people who can give me advice and, tell me what the next couple of years may look like. Individuals with adult children don't have that same luxury, because they don't have there are not generations of moms who have come before. And so at NDSS, we're really trying to fast track that process and saying, okay, let's get the experts together. Let's record the information. Let's get families together. We have a conference called the Adult Summit, in which we bring families together and give them that opportunity to talk about what are they going through, give adults with Down syndrome time to interact with each other, and really having that community aspect. We have countless webinars throughout the year of trying to help just disseminate information, and then virtual ways for people to connect. So trying to fast track what could organically happen over a couple of generations, but really trying to recognize generations now need help, and how can we help with that? Also, I would just say working closely with researchers to help understand, what do we know about Down syndrome and Alzheimer's disease, because the field is constantly evolving, and what the researchers are finding out, every month is extraordinary. And so making sure that we understand what's happening and that we can disseminate that information down. One thing that I find really exciting is every time I talk to a researcher, they always tell me about how much hope and how exciting it is to be in this field right now, and how much hope there is, which then, really allows me to help spread that hope among our families that it's going to be different. Things are going to be different. And I think that they will be different sooner than we could think they would be, which is amazing. And encouraging people to sign up for research, because the way the researchers and the scientists have all that hope and know all those things is because individuals with Down syndrome and their families have walked alongside them to help answer those questions. And so we really encourage people to sign up for research, to sign up for clinical trials, to help us better understand the path forward.
Real quick before we go to Anna, research is always exciting, especially when it gives us hope, right, for the future. Is there any particular single piece of research that you are most excited about that you may know about?
Oh my gosh. Well, I would say we work closely with Dr. Elizabeth Head out of UC Irvine, and she's working with a group of people, and they're actually coming out with like a special edition of a journal in which every single article is about Down syndrome and Alzheimer's disease. And I've been seeing them come out like every day. I get an alert about a new one, and I have to admit, I understand maybe half of them. Some of them are very technical, not all of them. I've sent some of them, I think, to your team to share about just the history of Alzheimer's and Down syndrome. There's some brain chemistry ones, like I said, that may be a little bit over my head, but there's some about physical activity and how it affects cognition. There's one actually from a self-advocate who is a young woman with Down syndrome who wrote about what this means for her and Alzheimer's. And she actually works with a research group out of Boston. So there's a lot in that. And as soon as it comes, we'll send it your way because we're really excited to help share it. But there's also some really great clinical trials going on right now. One is, and I can send you an information thing about this, but one is looking at, is there a way to actually turn off the gene expression so that the genes don't express all of the protein? There is one that's looking at the recent anti-amyloid treatments that were approved by the FDA maybe somewhere between a year and 2 years ago, to look at what that means for people with Down syndrome and the efficacy and safety. And then there's one that I forget the actual pathway of how it exactly works. But there are exciting things of people saying, okay, let's look into this. Let's learn more about how we can clinically stop this from happening.
Oh, that'd be remarkable. Thank you so much, Margot. Anna, she kind of set it up for you, but I want to talk about the advocacy. What is NDSS doing to advocate?
Yeah, absolutely. As I mentioned, advocacy is a core pillar of our work here at NDSS. It's so much fun for me to work with Margot's team and to be hearing the stories of families on the ground and the way that, our team really is stepping in some of just the darkest days of their lives to guide them and support them. But that also really informs our policy work because we know, as an organization, we can walk alongside families, we can develop resources, we can, train and equip clinicians, but we also need systems level change. We need policy change that's going to support that progress forward. So before even talking specifically about, some of our work in the Alzheimer's and dementia space, NDSS is really committed to reform and advocacy around long-term support services that support individuals their entire lives. So we know that Medicaid is the primary insurance for the vast majority of individuals with Down syndrome. And it's also the predominant payer of home and community-based services. So supports that can allow individuals to live in their communities, can support them as they age, can support home care in many individuals' lives. And so that's something that's really important to us, that it's not just, okay, how do we get transportation to work when we're in our 20s, but also how can we age with dignity in our homes if that's what families and individuals choose to want to do. So, we have a really large focus on advocating for that access, for increased services, when it comes to long-term supports and services all across the lifespan. But specifically when it comes to our Alzheimer's and dementia work, there's a few key places we kind of put a focus on. The first one is just about research and inclusion in all federal efforts. And we do that through our work supporting what's called the NAPA Council. So about 25 years ago, Congress passed a bill called the National Alzheimer's Project Act. And they had this really bold, ambitious idea that they were going to cure Alzheimer's by the year 2025. And we're in 2025. We obviously know that while very aspirational, that isn't exactly what happened. And also just our understanding of Down syndrome and Alzheimer's has come so far since that original bill was passed into law. So actually in 2024, the bill was up for what's called reauthorization. Since it was set to expire, it needed to be reauthorized. And Congress took really decisive action to reauthorize it. And we worked and championed alongside members of our community to ensure that, hey, this bill already has to be reauthorized. Let's make it as strong as possible for people with Down syndrome who really, really need it the most. And so the bill or the law now explicitly explicitly mentions individuals with Down syndrome by name, that they do experience Alzheimer's at a markedly higher rate. And it also directs and creates opportunities for what's called the NAPA Council, which is a quarterly advisory council that meets at HHS, to really create more opportunities for individuals with Down syndrome to be included in their work. And this is kind of where, we refer to it as ensuring that federal initiatives are inclusive of our community. We've kind of, prior to that law, already been finding opportunities. That council meets quarterly, and NDSS has sent a representative of our community to every single quarterly meeting for the past 3 or 4 years. You can find all of the really moving testimony on our website, but we send families who have lost their child. We send individuals with Down syndrome who, grow up knowing that this could be, what eventually they experience. And so, we've done that for many, many years now, but really exciting for us that with this law passing, there is kind of a more robust inclusion of the Down syndrome community, and we'll continue to work with that council to advance research and inclusion in a number of different areas. A few areas that we also really have put a focus on or done work in, you kind of think of the life cycle of Alzheimer's across your lifespan. The first is obviously around diagnostic care, understanding if you even have Alzheimer's to begin with. And as Margot mentioned, this poses a lot of challenges for our community because so much of the diagnostic models are not made with individuals with Down syndrome in mind. From a policy perspective, we're always looking for ways to ensure that if there are diagnostic models that are being used or approved by different federal agencies, that those are inclusive, but also that there aren't unnecessary barriers to diagnosis. So one example of this is that previously, PET scans were really the predominant way to diagnose Alzheimer's disease. We're lucky that the science has come really far, or actually the researchers tell us all the time, we're right on the cusp of exciting things like blood tests and much less invasive ways to diagnose Alzheimer's. But previously, Medicare and Medicaid would only cover one PET scan in an individual's entire lifespan. And so you think about an individual with Down syndrome who, as Margot said, may be misdiagnosed or, they waste their PET scan at 20 years old because, a maybe uninformed physician thought that's what was best. So we really worked to ensure that those coverage limitations were removed so that if individuals needed them in order to get the diagnostic screening that they needed, they would be able to get it. So ensuring that, there's that policies support better diagnostic care. Of course, if you get diagnosed with Alzheimer's, you hope that there's treatment and care then for you or your loved one. So we also work with a number of partner organizations on the development of treatments, like Margot said, ensuring there's pathways to those treatments then being approved by the FDA or CMS, and then, approved by FDA, and then also access through CMS. Again, I mentioned that individuals with Down syndrome their primary insurance is Medicaid, but many are also duly eligible for Medicare as well, even before they age into Medicare. And so we want to ensure that we work with the Centers for Medicare and Medicaid, CMS, to ensure that if these treatments are approved for the general population, and if they're approved to be safe for individuals with Down syndrome, which kind of gets into those clinical trials and safety, that they're actually accessible. And we saw this in a really big way a few years ago when the very first of the anti-amyloid drugs were being developed and got FDA approval, but then they got to CMS, and CMS said people with Down syndrome these won't be covered under Medicare and Medicaid for people with Down syndrome. And that was really concerning to us. Again, you take a step back and you recognize no one with Down syndrome was being prescribed the medication because there wasn't safety data there to support it. But that aside, the fact that an entire population who desperately needs access to this isn't getting it based solely on the fact that they have a disability is really concerning. So again, NDSS worked with a number of other Down syndrome and disability advocacy organizations and was actually successful in getting that removed so that if doctors deemed it safe and a good treatment path for their patients, then their Medicare and Medicaid would cover it. And then, of course, the last but certainly not least is around caregiving. And so we recognize, as Margot mentioned, that caregiving looks really different for people with Down syndrome and Alzheimer's disease. And so there's a number of things that we're working on in the caregiving space. I think one really big one is respite care. Again, you have these aging parents, and maybe they get some respite hours through, again, Medicare, Medicaid, but do they really have the tools, the resources they need to have respite and then to come back and really engage and care for their loved one? So that's, I think, a big thing we're always working on is respite for caregivers, support for caregivers, training. A lot of caregivers, like Margot said, don't know a single person who's ever raised someone who has Down syndrome and Alzheimer's. So how can we provide them the tools they need for that to be successful? And then I think another big one for us in the caregiving space, Margot kind of touched on, is around sibling caregivers and the fact that we have an increasing number of siblings that, we talk to who end up caring for their loved one with Down syndrome and Alzheimer's disease. And oftentimes there's barriers like they live out of state. And so getting their loved ones Medicaid or even Medicare, even though it's a national program, can still be really hard and confusing to navigate, and to allow them to move states to maybe live with a sibling or another caregiver. But also to just, again, understanding, wanting to have the broadest and most accessible level of support and coverage so that individuals, again, can still age with dignity and grace, even with Alzheimer's disease, and not be fighting these systems where they have to submit paperwork or they have to register or they, only get a certain number of hours of reimbursement. And so I think, at a larger goal too, is just making these systems more accessible for the people who rely on them.
Absolutely. Yeah. You guys are doing incredible work. I just so appreciate everything you're doing for these families. And in any way we can help you guys, we're happy to do so. Charlotte, we're coming to the end, so I'm going to come back to you. Is that okay?
Mm-hmm.
Okay, great. I just want to kind of talk to you and give you the time to share whatever you would like to let people know everything you want them to know about you.
Well, people with disabilities have their own hopes, dreams, and desires. We all want to feel like we belong, and we all want to be included. Having a disability is a natural part of life. People with disabilities are more alike everyone else than we are different. People with disabilities, including Down syndrome, have the right to be proud of who they are, to be treated with dignity and respect, to participate in and to enjoy all that life has to offer, and to be included just like everyone else. Most importantly, what we all share is our humanity and our inherent value and worth.
Well said, Charlotte. I will say the world would be a better place if people thought like you. Well, ladies, Margot, Anna, Charlotte, thank you guys so much for the work you're doing and for your time to join us today. We appreciate you, and we look forward to continuing to support the work you guys are doing, and hopefully we'll get to talk again soon.
I hope so. Thank you so much for this opportunity. And as you can tell, we're all very passionate and love to talk about this topic. And so we're working real hard to rein ourselves in. But, if anybody ever wants to hear more, then please reach out.
Oh, absolutely. Thank you, guys. Have a great day.
Thank you.
Thank you. Bye.
Thank you for joining us today here at All Home Care Matters. All Home Care Matters is here to help families as they navigate these long-term care issues. We invite you to visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And remember, you can listen to the show on any of your favorite podcast streaming platforms, or you can watch the show on our official YouTube channel. Just make sure that you hit that subscribe button so that you never miss an episode. We'd also like to say thank you again to the team from the NDSS, the National Down Syndrome Society. We look forward to seeing you again here at All Home Care Matters.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.